In this video, I'm going to briefly discuss some troubleshooting around nasogastric tubes. So let's say you come to assess your patient and they say, I have nausea. Now and they feel bloated and they feel distended, that would be odd if the NG tube was working perfectly well. And so after having done an abdominal assessment and talking with the patient, we need to re-examine what could be going wrong with this NG tube. So first of all, what could be happening is, assuming all the suction's working and everything, the tube might be in the wrong place. So the first thing we're going to check is our internal and external measurement where it should be? If it is, then we know in terms of how it was initially placed, nothing has changed. But maybe what we need now is an x-ray to see if it's actually sitting in the right place in the stomach. So it could be that it's in the stomach, but it's still pretty high. So maybe the initial measurements were not taken correctly, and there's still fluid building up below the NG tube, and it needs to be pushed in a little further. So again, one intervention might be get an x-ray to check placement of the tube. Of course, if it's not in the right place, and we can see it already, then a registered nurse may want to push it in a few extra centimeters, or again, they might default to getting an x-ray just to see what needs to be done and take that advice. So that's one way of troubleshooting through the issue. The second thing that could be going wrong is, again, as I talked about in another video, there could be kinks in the line, so look for those. Sure, if it's kinked, unkink it and see if you get flow through and see if they feel relieved. Another issue could be that this air adapter is being put on the wrong way. If it is, you put on a pair of gloves and simply turn it around. If that's the problem, you'll get NG flow immediately and they'll feel relief. Checking to make sure everything's connected, nothing's kinked. Then you look at your actual suction system and you say, okay, is this working? Is the suction on the right rate? With gloves on, actually take this apart and check to see if the system is connected. I've had the situation sometimes where suction is showing at, say, 50 millimeters of mercury, but the actual suction tube from this device is not attached to this canister. So the whole system was never set up properly in the first place. So you actually have to check to see if you've got suction working throughout the suction system itself. So assuming you've checked all that and you still don't have flow, nothing's still flowing, then you have to assume if it's in the right place, your whole suction machine is working properly, everything's hooked up, there's no kinks, adapter's on right, then you have to assume there's a blockage somewhere in the NG tube. Maybe some gastric contents got stuck there. Maybe it's even stuck to the side of the stomach wall and sucking on the stomach wall until no liquid can be sucked out. So in that case, what you'll do, and I'll just talk through this now, I'm not going to demonstrate it because that would be a different video, is you would don gloves, you would turn the suction machine off, you would take this apart and you would try flushing through some water to see if you can, like say 40 cc's of water, to see if you can get clear out the clog or stop it from sitting against the stomach wall. Then you can reattach and see if you get suction. If that works, great. If not, another option is to get pancreolipase capsules ordered to get them down into the tube and wait the required 15 minutes or so to see if they break up what's blocking it. Of course, if none of that works, you may need to collaborate and have the NG tube reinserted, the new NG reinserted. So those are just a few ways of troubleshooting through NG system. Again, the main thing that's going to tip you off that the NG tube is not working right and the system is not working right is like either one, your patient's complaining of nausea, or number two, you look at the system and things aren't flowing at all. And so it could be one or both of those things. And that concludes our brief video on troubleshooting some common complications with NG tubes.